Welcome to the Dr. Osborne Zone. Today, we've got Dr. Evan Hirsch. He is a medical doc who specializes in fatigue, chronic fatigue, and long COVID, among other things. If you've got energy problems, he's got energy solutions. And so happy that we could have him here today to pick his brain. Thanks, Dr. Hirsch, so much for being with us.
Thanks for having me on.
So let's talk a little bit about long COVID. It's a topic that a lot of people are top of mind. Tell me a little bit about your experience with long COVID. What kind of person is dealing with long COVID?
Yeah, it's really interesting because, when we look at the people who are getting sick from COVID itself and they're ending up in the ICU and dying and the hospitalizations, it's very different from the person who's actually getting long COVID. The person who's getting long COVID is actually younger, more athletic. Oftentimes they have less severe symptoms. So it's not a really bad flu. Sometimes they'll have five or so different symptoms that are more mild, and the symptoms then either just persist or get worse, or they go away and then they seem to come back. But those are the people that we're seeing who end up getting long COVID.
What do you think is the reason? I mean, you mentioned kind of the person we wouldn't maybe not expect or suspect. What are your underlying thoughts as to why these individuals are getting it?
Yeah, I think there's a couple of things happening. And I think that the biggest thing is having an immune system that's not exactly working right. So a lot of these people, they're exercising, they're doing really well. And oftentimes they're going back to exercise too soon, and it kind of compromises their mitochondria. And so there's this connection here where the immune system is distracted by something that's in the body that's not supposed to be there. So that's usually heavy metals, chemicals, molds, or sometimes it's other infections like Epstein-Barr virus or Lyme or something like that. And that kind of sets the stage. And so when the COVID comes into the body, the immune system is distracted. It's off in left field over here, so that the COVID comes in and it can kind of get deep into the body. When your immune system is strong enough to get rid of the COVID, that's when you have a really strong reaction. You feel like you're getting the flu. Sometimes it's the worst flu of your life, but the immune system is then getting rid of the infection. But it's the heavy metals, the chemicals, the molds, and other infections that are already present that set the stage, and then the COVID's the straw that breaks the camel's back.
So the COVID comes in, the body kind of mounts a response, beats it back a little bit, but they still have so much other background noise environmentally or dietarily that they just don't make a full recovery, and they just feel bad, and that's long COVID. Is that fair to say?
That is fair to say. Essentially the immune system's main job is to get rid of things out of the body that aren't supposed to be there. Right. And so if it's not able to get rid of the COVID like it's supposed to, there's something that's interfering with it. And that's what we find is that once you get rid of these toxins, it just makes it a lot easier to get rid of the COVID.
Let's talk about your experience then in working with people, with long COVID. What are the strategies? Are you testing to determine objectively, like, what kind of toxic burden they have? Are you detoxing them? Kind of walk us through what that might look like.
Yeah, so I have a 4-step process that I take people through, whether they have chronic fatigue, ME/CFS, long COVID, or MCAS, mast cell activation. And the first step really is determining what causes they have. Now, fortunately, there's 75% of these causes that we're looking at can be determined by symptoms alone. So we always like to look at history and symptoms, but then, of course, we're going to need labs for some of those, and we'll talk about those in just a minute. But we're looking at around 38 different causes, 38 potential causes. And so whenever I see somebody who has one of these different syndromes, it's because they have a number of these and the body just can't deal with it anymore. So it's usually somewhere around 15 or 20 different causes. Now, when I had my chronic fatigue, I had 30 out of these 38 different causes. And so when you actually know what causes you have, then you can create a map. You can match up the cause that you have with a treatment that's going to work for that particular cause. And then you can plan yourself out for success. It's kind of like if you're going on a trip and you don't have a map for how you get there, there's no way that you're going to be successful, right? Or if you miss something like mold because you think there's no possible way that I have mold and you don't address it, you're not going to be as successful as you could be if you were actually addressing some of those things that you do have. So that's first step. Any questions about that before I go on to the next step?
No, keep going. It's good.
Okay. So then step two is to replace the deficiencies. So when we look at those 38 different causes, we can group them into deficiencies. These are things that are not in the body that are supposed to be there, and toxicities. These are things that are in the body that aren't supposed to be there. Now, this process is all about removing the toxins, kind of like the bad five, like I mentioned before, the heavy metals, the chemicals, the molds, the infections, and trauma. Those are the things that really need to be worked on, need to be removed. However, in order to make people more successful, we need to make them more resilient first. We need to give them a little uptick in their energy, decrease their inflammation, and we do that by starting to replace the deficiencies, working on lifestyle habits, making sure they've got enough good food, good water, good movement, good sleep, adrenals, thyroid, mitochondria, which makes 70 to 90% of our energy, B vitamins, vitamin D, mineral deficiencies. So boosting those are going to be really valuable for setting people up for success when we get into step four. So that's step two. And then in step three, we start to open up the drainage pathways. So in order to get this crap out of the body that's not supposed to be there, we have to make sure that there's an exit strategy. So we have to make sure that liver, kidney, lymph, neural lymph that's in the brain, intestines, gallbladder, all of those pathways are quote unquote open so that you actually have a place to go when you start to grab the heavy metals, the chemicals, the molds, the infections, and try to get them out of the body. So that's step three. And this is actually one of the main reasons why people, when they have had Lyme or have had mold and they go for treatment and they just don't feel better, or if they have a lot of sensitivities or they feel worse during a process, it's because step three hasn't been done adequately. If you're grabbing these toxins, trying to get them out of the body, and they got no place to go, you're just going to feel worse. So that's why step three is important. And then we get into step four, which is removing those toxins that we've mentioned. And especially with long COVID, it's to make sure that we're also using antivirals that are going to be appropriate, because that's one of the things that we're finding is that, and conventionally they'll say that the infection is gone after a month, but that's not what we're seeing at all. We're seeing that you have to address it with antivirals in addition to getting rid of the toxins that are inhibiting the immune system from helping you get rid of the infection.